Hello, my name is Greg Gertner, and I've been a local independent sales agent and Medicare educator for the past 11 years. I'm not employed by Medicare or the US government in any way. I offer Medicare products from many private insurance companies so we can focus on what is the best fit for you. Thank you for joining me today, and we will be discussing the different parts of Medicare and how they work. I like to call this the ABCs of Medicare. Before we get into the meat and potatoes of Medicare, I'd like to share with you a little bit about why I became a health insurance agent. Both of my parents were in the medical field. My mother was a surgical nurse and my father ran hospitals. I was taught from a very early age that we should help the people around us. I took this to heart growing up and started college and expected to become a doctor. However, I found that hospitals were not a place that I wanted to spend my adult life, and I drifted into other things. In 2009, I started working with a company that focused on Medicare members. And I came to realize I had found a group of people really lacking the help they needed. I've been focusing on Medicare education ever since. So enough about me, on to Medicare. The first thing to understand is Original Medicare, or Parts A and Part B. This is a federal program for people 65 and older, as well as some people under 65 who qualify due to disability or health. Part A has a zero premium for most U.S. citizens and legal residents who have worked and paid taxes for 10 years or 40 quarters. Part B has a premium of $144.60 per month. This can be higher depending on your income level. Here is what Medicare card looks like when you receive it. It's a red, white, and blue card. It includes your name, your Medicare number, and the date Part A and Part B were effective. This is an important card, so make sure you put it someplace safe. Your Medicare initial enrollment period takes place when you turn 65. You have 3 months before the month of your birthday, the month of your birthday, and 3 months following the month of your birthday to enroll in Medicare and any additional benefits you may choose. If you're receiving Social Security benefits at the time of your 65th birthday, your enrollment in Part A and Part B will be automatic. However, if you are not receiving your Social Security benefits, then you'll need to enroll yourself. I recommend you do this by going to ssa.gov and enrolling online. Enroll early, about 90 days or so before your 65th birthday, to make sure you get your card and avoid any gaps in coverage. You may also refuse or defer enrollment in Part B if you have employer benefits through yourself or a spouse. Once you have your Part A and B, you can enroll in a Medicare Advantage plan or a prescription drug plan and Medicare Supplement plan, which they also call Medigap plans. First, let's talk about your coverage with just Original Medicare. Part A is premium-free for most people and covers inpatient hospital care. Part B covers your medical services like doctor's visits, testing, outpatient and inpatient procedures, as well as preventative care. The premium for Part B is $144.60 per month, but you could pay more than that depending on your annual income. There are deductibles, co-pays, and co-insurance costs associated with Parts A and B, and I've listed them up here for your reference. But in general, you want to remember that Medicare will cover about 80% of your major medical expenses, and you're responsible for the other 20%. To help with the 20% that Original Medicare doesn't cover, you have a couple of options. Option one is to enroll in a Medicare Supplement insurance plan and a prescription drug plan. Option two is to enroll in a Medicare Advantage plan, also called Medicare Part C, which in most cases will include your prescription drug plan. You can schedule a one-on-one appointment with me to discuss your specific needs by calling 707-992-5950 or by going to my website at www.gertnerinsurance.com and clicking the Request an Appointment button on the top. Now, let's talk about some of the benefits of a Part C or Medicare Advantage plan. Medicare Advantage is known as an alternative to Original Medicare. Members of Medicare Advantage plans will still be a part of Medicare. However, all of the benefits, including your Part A and Part B, are going to be administered by the plan. These plans are offered by private insurance companies, and they will have specific networks of providers and facilities that you're to use. They are generally either an HMO or a PPO plan, and you must continue to pay your Part B premium, as well as any premium for the plan itself. Some of the benefits of a Medicare Advantage plan include helping to pay your hospital stays, as well as some of the medical care like doctor's visits, preventative care, flu shots. Okay? Most plans help pay for your prescription medications, and they may include things like routine vision coverage and hearing exams. Another important benefit of Medicare Advantage plans is a limit to your annual out-of-pocket expense. This is called the maximum out-of-pocket. Now, let's talk about Part D, or your prescription drug coverage. There are two ways to get prescription drug coverage. One is through a standalone Part D plan, and the other is through a Medicare Advantage plan that includes prescription drug coverage. Both of these are offered by private insurance companies. It's important to review prescription drug plans to make sure that your medications are on their list of covered medications. This is also called the formulary. Some important features of prescription drug plans are that they have a pharmacy network, having preferred and standard pharmacies as well as mail order pharmacies that you can use. Generally, either the preferred or the mail order pharmacy will give you the best value on your medications. Remember that drug plans have a list of covered medications, also known as a formulary. This formulary will break down medications into tiers. In general, most plans have 5 tiers. The first tier will be a preferred generic drug, and that'll be the least expensive. Tier 2 covers non-preferred generic drugs and will cost a little bit more. Tier 3 is going to be the preferred name brand drugs. Tier 4 is going to be the non-preferred name brand drugs. And Tier 5 is going to be the specialty medications, and those are the most expensive. Medicare drug plans work a little differently than you may be used to. They're broken down into coverage stages. The coverage stages for a prescription drug plan start with the annual deductible. Not all plans have an annual deductible, but many do. The next stage after the annual deductible is the initial coverage stage. During this phase, you pay your co-pays for your medications based on their tier until the total drug costs paid by you and the insurance company combined reaches $4,130. At that point, you enter the coverage gap, or the donut hole. While in the coverage gap, you pay 25% of the cost of all of your covered medications until you reach a total out-of-pocket cost of $6,550. Once you reach the out-of-pocket maximum of $6,550, you enter the catastrophic coverage phase. Once you hit this phase, you will pay a small copay or coinsurance for the rest of the year. Many people will never reach the coverage gap, but for those who have a lot of medications or expensive medications, it is something you need to be aware of and budget for. The cycle starts over again every year on January 1st. People with limited income may qualify for some extra help to cover some of these Part B costs. Now let's take a little break here with some pictures of the family. They are the most important people to me next to my clients. I also want to remind you that I'm always available to help with your specific questions. So my phone number is 707-992-5950. I have also put my contact information in the chat area so you can contact me at any time. Now, on to Medicare supplement plans, also called Medigap plans. These are federally standardized plans provided by private insurance companies. They help pay some or all of the deductible, the copays, and coinsurance not paid by original Medicare. You cannot use these plans with a Medicare Advantage plan. You either have a supplement and a prescription drug plan, or you have a Medicare Advantage plan, not both. There are 8 supplement plans available, lettered A through N. Now, Massachusetts, Minnesota, and Wisconsin are exceptions, and they have a slightly different set of standardized plans. But in general, Medicare supplement plans are not tied to a specific provider network. Therefore, they may be a good choice for people who, say, have homes in different states. Here's a snapshot of the different medical supplement plans that are available. As you can see, each plan has a specific percentage that covers for your deductibles and co-pays and coinsurance. That original Medicare does not cover for you. To get a quote on premium costs based on your age and zip code, you'll have to contact me to set up an appointment. So to review the difference, coverage choices that you have when it comes to your Medicare benefits. First, you need to enroll in Original Medicare, which is your Part A and Part B. Once you have Original Medicare, you have two options. Option 1 is a Medicare supplement plan and a separate standalone prescription drug plan. Option 2 is a Medicare Advantage plan, which will usually include your prescription drug plan as part of the package. I need to talk now briefly about additional enrollment periods. Your initial enrollment period, as I said, is the 7 months around your 65th birthday. There's also an annual election period, or AEP, every year from October 15th through December 7th, when you have the opportunity to review Medicare Advantage and prescription drug plans. There are often changes in those plans or new plans available during AEP, and now you're allowed to make a change if you like. January 1st through March 31st is the open enrollment period, or OEP. This is for people already on Medicare Advantage plans. During OEP, you can drop your Medicare Advantage plan and return to Original Medicare and a prescription drug plan, or you can enroll in a different Medicare Advantage plan altogether. Also, throughout the year, there are special enrollment periods that are triggered by qualifying events or changes. These changes could include a retirement, losing employer health coverage, moving out of the plan's service area, change in your extra help status, or being diagnosed with certain qualifying chronic health conditions. Now, something I get a lot of questions about. There are some late enrollment penalties if you don't sign up for Medicare when you're first qualified. This is important. This does not apply to people who have health coverage through an employer, a spouse, or a union retirement plan. Penalties are applied for a lapse in coverage once you qualify for Medicare Parts A and B. If you do not have coverage through an employer, a spouse, or a union plan, then there is a 10% penalty for every 12 months you go without Part B coverage. For prescription drug plans, if you lapsed your coverage for longer than 63 days, 1% of the national average drug plan cost will be added to your drug plan premium for every month where you're without coverage. For example, without coverage for 6 months, you would have 6% of the national average plan cost added to your drug plan monthly. These plans are added to your monthly premiums and they stay with you forever. Okay, people who qualify for Medi-Cal or Extra Help and Medicare may be able to enroll in specific plans that are designed for what they call dual beneficiaries. If you need help finding out if you qualify for Medi-Cal or some Extra Help programs, please contact me. We'll take care of that directly. I know we've covered a lot of information here, and that can be confusing. There are a lot of choices involved, and I'm happy to help you review all of your options, including any retiree or union plans you may have. I can help you understand the benefits and costs so you can make an informed decision that meets your specific needs and budget. There is never any cost for my help. Thank you for taking the time to join me today. I hope you got some of your Medicare questions answered. If you still have questions, you can contact me at 707-992-5950, or you can email me at info@gertnerinsurance.com if you'd rather. You can even enter any questions in the chat area and I'll respond as quickly as possible. As a reminder, I'm not employed by any of the carriers I represent. I work for my clients and it doesn't cost anything to speak with me. I'm here to help.